Right. Okay.
Yeah.
So good evening, everyone, and a warm welcome to all of you. I'm Dr. Kashyap. I'm a psychiatrist practicing in Bangalore, and today I'll be talking to you about a group of illnesses that's often overlooked and misunderstood. Yet it impacts the lives of millions of people worldwide. I am, of course, referring to anxiety disorders. These conditions aren't your typical day-to-day worries. They are characterized by excessive fear, worries, or anxiety, which typically affects multiple spheres of life, right? So, in this presentation, I'll be talking to you about the various anxiety disorders. I'll be talking to you about the symptoms of each of those anxiety disorders. I'll be talking to you about the ways in which it affects the day to day life. And of course, the treatments that are available to deal with these disorders. And at the end of my talk, if time permits, we can have a guided relaxation exercise, which I think all of you can use to manage anxiety better. So let's get started with the talk today. So before we go into the disorders per se, I think it's important to have an understanding of three very important words, and that's emotion, affect, and mood. All right. So we've all used these words, but not many know the definition because what comes forward, what comes later, is based on the definition of these three words. So, coming to the word emotion, an emotion is an intense feeling which is linked to an external event or a stimulus. Typically, it lasts for a few minutes and not more than a couple of hours. And it has three very important components. And those components are the subjective experience, the physiological response, and of course, the behavioral response. So, to give you an example, if you were to lose your job tomorrow, the subjective experience would be sadness, that you're experiencing sadness. The physiological response is the production of tears, and the behavioral response would be the act of crying. So that is an emotion, something which is by definition cross-sectional. And affect, on the other hand, is closely linked to the behavioral response component of an emotion. That is the outward response of an emotion. And coming to the word mood, mood is an overall emotional state, typically not linked to any external event and lasting for several days by definition. It can even go up to several weeks, but usually it's for a few days. And that's mood. So just to kind of recap, the difference between an emotion and a mood is emotion is cross-sectional, mood is longitudinal. Emotion is linked to an external event, whereas mood has no relation to an external event. So now, having understood these three words, let's go into the words of anxiety and fear, right? Have you wondered the what the definition of the word anxiety is, right? And anxiety is an uncontrollable, diffuse, and an unpleasant state of negative affect, right? Affect is the outward response of an emotional state. I hope you remember that definition. So it's uncontrollable, it's diffuse, and it's unpleasant, and it's a state of negative affect. All right. And it's characterized by three very important states: a state of heightened vigilance, a state of anticipation of unavoidable future danger, and the production of physiological symptoms, that is, symptoms that are seen in the body. All right. So that's the definition of anxiety. And anxiety and fear have a lot in common. Both are alerting signals, meaning they warn us of impending danger. Thereby, it gives us some time to deal with this particular threat or danger. So, as we were talking just before the talk, low levels of anxiety and fear are absolutely essential because it gives us time to prepare and mobilize our resources, both within and without, to deal with this particular threat. But there are some very important differences between anxiety and fear. The most important difference is that fear is of sudden in onset and anxiety is gradual in onset. The nature of threat in case of fear is almost always known. Say, for example, you failed an exam. The fear of consequence is known, it is definite, and it is external, meaning that you fail the exam, there is the consequence that you're going to get a scolding or a beating from your parents. So this is external. The fear of consequence is external and it is clearly defined. Whereas in case of anxiety, the threat is generally vague, it's unknown, and it's internal, meaning it is coming from within. So what is anxiety? So after having defined anxiety, I think it's most people know this fact that anxiety is one of the most common mental illnesses, along with the depressive disorder. Anxiety disorders are one of the most common mental health problems that are seen in India. Nearly 5 crore Indians have an anxiety disorder every single year. So, just to give you a context, the population of Karnataka is 6.5 crores, right? And nearly 5 crores have an anxiety disorder every year. And multiple studies have shown that females are more likely to be affected than males. And another Indian study has shown that the people in the southern states are more likely to be affected than the people in the northern states. And the reason they attribute is urbanization and modernization. So the corollary of this study is that as urbanization spreads in the north of the country, the incidence of anxiety disorders also will rise. There's no doubt about that. So you're looking at a scenario wherein the incidence and prevalence of anxiety disorders is only going to rise in the foreseeable future. And of course, there is no significant association of the prevalence of anxiety disorders and death by suicide. Anxiety disorders also are the second highest contributor to mental disorder DALYs after depressive disorder. So DALYs stand for disability adjusted life years. To put it in simple words, it is the number of years of potential healthy years lost, number of potentially healthy years lost. So if it is a one DALY, it means that you've lost 1 year of good health. If it is two DALYs, you've lost 2 years of good health. So anxiety disorders is the second highest contributor to mental disorder DALYs. So that's the burden of this particular problem. Coming to causes, like all mental illnesses, uh, the causes are a complex interplay between genes and the environment. And that is true of almost all illnesses, more so here in anxiety disorders. Meaning, if one of your parents has had an anxiety disorder, the chances of you having an anxiety disorder is greater than the general population. And if both your parents have had an anxiety disorder, the chances of you is almost 100% of having one or more anxiety disorders. So it is a complex interplay between genes and the environment. So now coming to the environmental factors, and again, so when it comes to genes, it is not one single gene that is involved. Multiple genes spread over numerous chromosomes are responsible for anxiety disorders. Environmental factors, there are a number of theories which are kind of, put forth, which explain anxiety. But I'll be concentrating on only three of them. Okay. And I think these three are very important. So the first one is something known as classical conditioning. Classical conditioning was put forth by Ivan Pavlov. I think all of you must be aware of his experiment with the dog, wherein he throws a piece of meat and the dog salivates, and all the experiments linked to that. Uh, fascinating experiments. I think you can kind of go through that when you're free. But when it comes to anxiety disorders, the theory that's put forth is something known as a paired association, meaning there is a painful stimulus known as a noxious stimulus, which gets paired with a neutral stimulus. The neutral stimulus being something as benign as sitting in a bus, shopping in a grocery store. It could be something which, by definition, does not produce any symptoms, is known as a neutral stimulus. So, here, the painful stimulus, that is the symptoms of anxiety, get repeatedly paired with a neutral stimulus. So much so, it leads to the avoidance of the neutral stimulus, because in the person's mind, they tend to overestimate the danger of the neutral stimulus and they underestimate their own coping mechanisms. So then, after the pairing has happened, they feel that traveling in a bus might result in anxiety, going in a subway might result in anxiety, talking to a particular person might result in anxiety, and they start avoiding these areas which they think cause anxiety. So that is known as classical conditioning. Wonderful theory, but it doesn't really explain why the pairing happens, right? It doesn't really explain the initial pairing which happens. It doesn't explain that. That's a shortcoming of classical conditioning. Then come the negative events of childhood. I think this is a very important point, often overlooked and often brushed under the carpet for various reasons. The separation of parents, death of one or both the parents, abuse, physical, emotional, and sexual abuse, parental overprotection, and substance use. It could be both tobacco, alcohol, and other substances, including cannabis, opioids, and the rest of them. And the third one, which I've not mentioned here, and I will be talking about a little later, are something known as cognitive distortions. Cognitive distortions are faulty thought patterns which eventually lead to anxiety disorders. These are the three most important factors which determine whether you develop an anxiety disorder or not. All right. Having talked about both genes and the environment, if we were to kind of, come down to a final common pathway wherein both the genes and the environment act in sync to produce an anxiety disorder, they both lead to what is known as a dysregulation of certain chemicals in the brain. All right. There are three important chemicals which are known as serotonin, norepinephrine or noradrenaline, and GABA. GABA stands for gamma aminobutyric acid. So for people who are interested to know what exactly happens with respect to these chemicals, I'll just briefly describe that. So you have certain cells in the back of the brain, right? Just above the neck, in the something known as the brain stem. And these cells, they send their projections to different parts of the brain, especially to the front part of the brain. So it comes right like this. These cells are really long, right? So they start here and they come right to the front. And also they go into the deeper parts of the brain, especially in the sides here. So these cells, which are responsible for the production of both serotonin and norepinephrine, different groups of cells. So the levels of serotonin are actually reduced. And with respect to noradrenaline, the levels of noradrenaline are raised. And if it is reduced in noradrenaline, it causes depression. Depression is very classical if the noradrenaline has come down. So these are some of the chemical changes which take place in the brain. So irrespective of whether you've had the genes, whether you've had genes from one parent or both the parents, and the environmental factors, the final common pathway is the chemical dysregulation in the brain. So just to kind of summarize the causes, think of a gun wherein the genes are the bullets and the environment which pulls the trigger. So both are required to have the illness. Either one of them are missing, you're not going to develop the illness. So coming to anxiety disorders per se, let's start with panic disorder. Panic disorder is the most common anxiety disorder, right? It is characterized by recurrent panic attacks. And what are panic attacks? A panic attack is an abrupt surge of intense fear or discomfort, which generally peaks in 10 to 15 minutes and then it kind of comes down. Something like a Gaussian curve, right? Goes up in 10 to 15 minutes and then kind of comes down. Usually, it is accompanied by symptoms such as palpitations, chest discomfort, shortness of breath, sweating, trembling, and the most important symptom being fear of losing control or dying. That's the most important and most classical symptom of panic disorder, fear of losing control. The patient here is fearful of having future panic attacks, right? He is fearful that, he might develop panic attacks in the future. That's another hallmark of panic disorder. And this fear leads to maladaptive changes in his or her behavior, meaning they tend to avoid places wherein they've had panic attacks in the past. Say, for example, if I've had a panic attack in the theater, in the future, what I would do is I would avoid going to all theaters, thinking that I'm going to have a panic attack if I go there. Okay, so that is another symptom of panic disorder. Panic disorder is usually coupled with agoraphobia. Agoraphobia is fear or anxiety about any of these situations which I've mentioned here. Fear of, being in open spaces or enclosed spaces, using public transportation, standing in a line or being in a crowd, or going out of one's home alone. And the reason the individual fears these situations is because he or she feels that escape might not be possible from these situations in case he develops panic-like symptoms. So he goes into the situation, he fears that he's going to have a panic-like symptoms, and then he feels that, okay, let me just kind of completely avoid the situation. That is the hallmark of agoraphobia. And usually the anxiety and the fear is out of proportion to the actual danger posed by that situation. And in fact, this is applicable for all anxiety disorders, right? And these situations are avoided, and the fear or anxiety is out of proportion to the actual danger. The other anxiety disorder, which is also quite common, is something known as generalized anxiety disorder. Generalized anxiety, if you have noticed the difference between generalized anxiety and panic disorder and agoraphobia, there is no fear in this particular illness. It is usually excessive worry. The person is constantly worried, as if he's on the edge all the time, So there is excessive anxiety and worry for most days, lasting for at least 6 months and affecting multiple spheres of his or her life. Some of the most important symptoms of GAD include feeling keyed up or feeling on the edge all the time. That's the classical symptom of GAD. The other symptoms include tiredness, inability to concentrate, losing your temper, muscle tension, and sleep disturbance. So when it comes to sleep disturbance, I would want you to keep in mind that the sleep disturbance is of three types: inability to fall asleep, inability to stay asleep, and early morning awakening. So these different problems are seen in different illnesses. Like, say, for example, in anxiety, it's typically the person has difficulty falling asleep, as opposed to a depressive disorder wherein the person has early morning awakenings. So early morning awakenings is pointing towards depression. Inability to fall asleep points towards anxiety, right? Of course, we take into consideration all the other symptoms before making a diagnosis. The next one is something known as social anxiety disorder. Social anxiety, this is very commonly seen. And I have a confession. I had social anxiety when I was in class 10 and class 11. Um, I have learned to I've learned to kind of, overcome that. But it took some time though. Social anxiety is marked fear or anxiety in social situations wherein the individual is exposed to scrutiny by others. Typically, when you are talking to a group of people, when you are kind of making presentations, when you're talking to your juniors or your seniors, basically a group of people, that's when the person becomes very anxious. Here, the individual fears that, he will be judged negatively. That means he will be negatively evaluated. And the reason he is negatively evaluated is that he fears that he will say something or do something which will be embarrassing or humiliating. And that is the core symptom of social anxiety. Fear of saying or doing something which will be embarrassing or humiliating. And that makes the person very fearful or anxious. Usually, these social situations are avoided. And if they cannot be avoided, they are endured with intense fear and anxiety. This consequently leads to significant impairment in significant distress in multiple areas of functioning, especially for those who are working. It can affect their promotions, and it can seriously affect their career growth. Not so much if you're a student, because most of our education is focused on marks, mainly in people who are working. And of course, like all other anxiety disorders, the fear is out of proportion to the actual threat posed by the social situation. Specific phobia. These phobias, I think most of you might have heard of: fear of heights, fear of closed spaces, fear of water, fear of insects. All that points towards specific phobia, which refers to fear or anxiety about specific situations or objects, right? The phobic object here almost always provokes instantaneous fear or anxiety and is actively avoided. The fear or anxiety is out of proportion to the danger posed by that particular object, right? So recently, I had a patient who had a fear of lizards, right? Herpetophobia. It was to such an extent that the patient told me that she refuses to stay in the same house, even if it had one lizard in it. And that really kind of caused a significant impairment in her interpersonal relations with her husband and her children. Um, uh, she's doing well now, but the problem was she had these symptoms for several years before she was able to recognize that it's an illness and that she needed treatment for the same. Some of the phobic stimuli are animals, natural environment, that's usually is the fear of heights, blood injection and injury. We have quite a few patients who feel giddy the moment they see blood, and it can also be situational. All right, so that's specific phobia. Separation anxiety disorder is not a very common anxiety disorder. It is usually seen in children, but increasingly it's even being seen in adults. All right, so that's excessive fear or anxiety when it comes to separation from those the individual is attached to. The recurrent excessive distress when the person is anticipating separation from home or major attachment figures. And the person constantly worries about losing major attachment figures and experiencing events which lead to separation from major attachment figures. Again, not a very common anxiety disorder, but I've included it just for completion's sake, because those of you who have children, there is a small chance that the child might be having this if he or she refuses to go to school, right? So separation anxiety disorder is something that you need to keep in mind. Usually, such kids will have physical symptoms when the separation occurs. Usually, it's headaches, stomach aches, nausea, or even vomiting. All right. So, if you recollect the environmental factors when I was talking about the causes for anxiety disorder, the first one was classical conditioning. The second one was negative events in childhood. And I told you that I am going to talk about something known as cognitive distortions, right? Cognitive distortions are a very fascinating phenomena, and all of us have been victims uh, to these distortions. Basically, what it essentially means is faulty thought patterns. You're essentially your mind tricking you into believing things that are not supported by facts. All right. So the first cognitive distortion is known as minimization and magnification, wherein the person minimizes his achievements and magnifies his failures. So I think you can just kind of go through the examples that I've given here, and I'll just give you the definition. So the second one is overgeneralizing. Here, the teacher sees one particular student who's asleep and then kind of generalizes that the whole class, or assumes that the whole class is bored. The selective abstraction is the person takes one context, one particular factor in a particular context and believes that, and ignores all the other factors which are present in that particular context. Personalization refers to taking personal responsibility for collective failure, right? Arbitrary inference is when you come to a conclusion or an inference which is not backed by facts, or even if there is evidence to the contrary. Dichotomous thinking refers to black and white thinking. Either I pass this exam and my life is good, or if I fail this exam and my whole life is ruined. And finally, catastrophization refers to thinking about the worst case scenario at each and every level, right? So if you have one particular symptom, you think about the worst case scenario. Pain in the head, you think that you're having a stroke. Pain in the chest, your thought process tells you that you're having a heart attack. That's catastrophizing. So these are cognitive distortions. Eventually, they lead to anxiety disorders. Coming to the treatments available, there are essentially two major pathways wherein we can kind of go down and deal with these issues. The first one is medications, and that's what I specialize in. Medications are safe, proven, effective, and non-addictive. Non-addictive, at least the most commonly prescribed medications are non-addictive. All right. The second option that we have is something known as psychotherapy. Psychotherapy is essentially CBT. CBT is cognitive behavioral therapy. And the basis for CBT is that we identify the faulty thought patterns, also known as cognitive distortions, and we replace these faulty thought patterns with healthier patterns of thinking. And thereby, it is assumed that we have a better control of our emotions, and also we change the way we behave, right? So the symptoms of anxiety come down and we are in better control of our emotions. So that is achieved by changing the way we think. So essentially, medications and psychotherapy are the two main treatments that are available to treat anxiety disorders. There are other strategies which can also be used to kind of deal with anxiety which has not yet reached the level of a disorder. Meaning, you have anxiety, but you're not fulfilling the criteria to be diagnosed with an anxiety disorder. And some of these coping strategies include deep breathing, and that's the physiological sigh, progressive muscle relaxation, which is also known as JPMR, discovered by Jacobson, right? It's called Jacobson's progressive muscle relaxation. Mindful meditation, lifestyle changes, especially stopping all substances, tobacco, alcohol, and also getting in some exercise every day. And of course, dealing with any underlying stressors. If you have a particular stressor which is responsible for your symptoms, dealing with that will eventually lead to resolution of your anxiety, right? These are some of the coping strategies which people can use.